Hi, welcome to my first Google Hangout. Unfortunately, my internet connection is not fast enough to support a camera, but you can see who I am on your screen now. My name is Brigitta. I'm an author, coach, and speaker, and generally speak about cancer and alternative health and well-being. Today's Hangout is about cancer and thoughts, and how your thoughts affect your body in a physical manner, and how your thoughts can create the perfect environment for cancer or create the perfect environment to fight the disease. I've got a screen share PowerPoint slide presentation. Hopefully it's going to work. So we'll start that screen share now. Okay, so essentially my lectures are generally about putting the pieces of the cancer puzzle together. When you are diagnosed as a cancer patient, you are faced with a mountain of information and sometimes no information at all. And putting those pieces of the puzzle together is essential for working out a set of therapies and set of ways that you can cope with the disease that work for you. This information is obviously not approved by the FDA, or I don't provide therapies in any form or manner. I'm just trying to provide you the pieces of the puzzle so that you can understand the entire picture. So the parts of the puzzle in terms of your thoughts and cancer, you need to understand firstly how we produce energy as humans, how our cells actually produce energy, because that is a big part of the cancer puzzle. You also need to understand how your thoughts affect the body in a physical way, and you need to understand how cancer works, what cancer requires to thrive and survive, or what we need to fight cancer. And once you have that information, you can put those pieces together and decide how you see the cancer puzzle. So how do we create energy? The simplest way to understand how we create energy is cells use glucose to create energy molecules that we use. Now, cells produce energy in two ways. The first is that they use a little molecule called GTP, which they convert into an energy molecule. The second way that cells can produce energy, and this is just two of the ways that cells use, is by glucose fermentation. Those are the two that are most important to understand in terms of thoughts and in terms of cancer. Healthy cells have enough GDP and can create energy from the GDP using oxygen or respiration. In cancerous cells, there's not enough GDP. So cancerous cells survive and thrive by fermenting glucose to create energy. That's what Dr. Warburg found in the 1930s, and he was given a Nobel Prize, and that is still true today. So in terms of thoughts, what we need to understand, our thoughts are merely a way of creating emotions. Our thoughts prompt us to feel a certain way. Negative thoughts prompt us to feel negative emotion or stress. Positive thoughts, on the other hand, relieve stress. They create a system in the body that is called rest or digest, and that relieves stress. There are two systems in the body. There's either the war system or stress, and there's the peace system. They're controlled by the HPA axis, and your body is either in a state of stress or in a state of peace. Now, the state of stress is brought about when the body starts producing cortisol. And cortisol is really, really important in the cancer scheme of things. Cortisol does a number of things, has a number of physical effects in the body. Firstly, cortisol switches off the immune system, or the HPA axis switches off the immune system. It also switches off digestion, so you can't get the nutrients that you require to fight the disease. And cortisol depletes the body of adrenaline. So in terms of cancer, what cancer really needs to survive, or in terms of the thought piece of the puzzle for cancer, is glucose fermentation. Every single cancer cell thrives on glucose fermentation. Cancer cells also thrive in a high pH environment or an acidic environment. In fact, cancer cells even create their own acidic environment to make sure that they have the best place to thrive and survive. Cancer cells can only thrive in where the immune system is depleted, or a broken immune system. And finally, cancer cells need a high glucose environment to survive. So, cancer cells survive on the energy produced by glucose fermentation. They thrive in a high acid pH, and they thrive where the immune system is depleted. How our thoughts plug into that whole puzzle is that negative thoughts create excess cortisol in your body. When you're under stress, your cortisol levels increase. Cortisol actually depletes the adrenaline stores of your body. Your cells need adrenaline for respiration. In other words, your cells need adrenaline to create the ATP molecule from GTP. If there is no adrenaline, the cells have to use glucose fermentation to start creating energy. And that's where the problem starts, because by having a high stress level, increased cortisol, you have less adrenaline, so you force your cells to use glucose fermentation for energy. So stress is therefore one of the direct causes for why cells start becoming precancerous. Stress creates excess cortisol. Cortisol actually switches off the immune system in the body. The body says, if I'm running away from a tiger, or if I'm fighting for my life, I don't need to fight bacteria. So stress actually switches off the immune system, which again encourages the cancer cells to thrive and survive. With a healthy immune system, the immune system cells actually attack the cancerous cells and get rid of them on an ongoing basis. In terms of the functions of cortisol, cortisol actually regulates the pH level of the body. When there's an excess amount of cortisol in the body, the pH of the body begins to rise. And as I said at the beginning, acidic levels or acid levels of the body are essential for cancer cells to thrive. So by increasing the cortisol, we're increasing the acid level of the body, and cancer loves acid. Cancer lives and thrives in acid. So we need to start regulating those cortisol levels. And finally, when you go into a state of flight or flight, the body prepares to fight or to run away. That seems obvious, but what it actually does, what the cortisol does, is it increases the amount of glucose available throughout the body. It obviously increases the energy to the muscles so that you can run away. That increase in glucose creates the high glucose environment that allows cancer to thrive, or to start, or to survive, or to flourish. So cortisol actually creates the perfect environment for cancer cells to take hold and thrive. And cortisol is released when you feel negative emotion, when your thoughts create an emotion that you feel: fear, stress, anger, hatred. Those are all emotions that will switch on the cortisol production in your body. So in summary, you can control your thoughts, or rather you can control the emotions that your thoughts produce. And it's essential to start learning to undertake techniques, especially if you've been diagnosed with cancer, to learn to control your emotions, to start monitoring your emotions and reacting to them in a way that does not cause your body to release excess amounts of cortisol. Excess amounts of cortisol create the perfect environment for cancer. They shut down the immune system. They create an acidic environment. They increase glucose within the system, and they change the energy production, the base energy production, from a normal cell respiration to that of fermentation, which is a precancerous or cancerous environment. There are a number of references for this slideshow. You're welcome to pop onto our website. This will be on the website, along with all of the references that back up what was said. Some of the references are on this slide if you'd like to look up Dr. Otto Warburg, or if you'd like to look up psycho-oncology to see how adrenaline is depleted, or under body and pH, if you look up pH test us, you'll find a website that goes through all the body pH and acidic levels. In terms of studies, the real-world studies about psychological intervention or psychology as a means to help cancer patients cope and improve their ability to monitor their emotions, the studies have shown that there's a reduction in depression and inflammation when patients have been given psychological support. That inflammation is also one of the keys to cancer and one of the keys to creating the right environment for cancer or reducing the environment for cancer. Dr. Spiegel showed that psychological intervention increased survival rates. There was an increase in quality of life. Dr. Forzy's work on psychological intervention showed the lower rate of recurrence for patients who'd received some sort of psychological support. There was a lower rate of mortality. Dr. Young showed that there was a lower rate of mortality and also recurrence. Dr. Langacher actually measured the immune system cells and how cytotoxic they were. In other words, how well the immune system killed off the cancer. And the intervention of psychological therapies in cancer patients actually increased the amount of cancer that the immune system killed. In other words, the cytotoxicity had increased in patients given psychological therapy. On mindfulness-based stress reduction therapies, there's the work of Dr. Michael Specker, Dr. Carlson, Dr. Kivitz, Dr. Shapiro. The studies are extensive as to how psychological support and therapy can actually help you to not only cope with the disease and improve your quality of life, but also actually improve how well your body fights the disease. So what you can do if you have been diagnosed with cancer is invest in stress-based therapies. Every person is different. The kind of therapy that you find for yourself will be different from everybody else. But find one that you can believe in, that will help you to cope and help you to change those emotions from negative to positive. Mindfulness, stress-based reduction, there's plenty of information on the internet, plenty of clinicians that offer MSBR that can help you. In terms of EFT, if you'd like, I can help you with tapping sessions. There's, again, plenty of information, plenty of tapping sessions. EFT, personally, I find the most powerful to deal with negative emotions. But like I say, it's up to you. Join group support. Join local support groups in your area. With 44% of us now being diagnosed with cancer, there is support. You are not alone. Speak to a cancer counselor. Join our website. You'll find more information about the cancer puzzle and how you can put together a strategy that works for you. What I'd like to leave you with is sometimes hope is all you have. But if hope is what you have everything, because you've seen how physically hope can change your physical body to actually allow you to start fighting the disease. This information is brought to you by Green Health Matters. As I said, my name is Brigitta. I'm an author, speaker, writer, bringing you vital cancer information because you can't fight what you don't understand. We'll have these hangouts once a week. Feel free to join me. Link up with me on greenhealthmatters.com or via Facebook, Facebook.com/Green Health Matters. In your good health, I hope that you will take steps to sort out your psychological approach to cancer, because it's one of the key pieces of the puzzle in this devastating disease. And love and light to you, and I hope I see you soon.